Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about the autism therapy program that we offer at the clinic. As you all know, autism is a neurodevelopmental disorder, the primary problem being social and communication difficulties. The aim of the program is to help parents improve their communication skills and adapt the environment to suit a child with communication problems. So it is actually training the parents to carry out the program at home. The goal of the therapy will depend on the evaluation. It is done once a week. The parents sit in, not only will they observe, but they're also trained, and whatever they do is checked again next week. Also, our social worker will follow up on phone as well as on the internet. We give a complete information and guidance booklet with step-by-step help and materials and assistance. Now, the various therapies that we do are eclectic in approach. I use both the relationship-based therapy and the behavioral-based therapy. Choice of the program depends upon the age of the child, the level of autism, the language abilities, if the child has challenging problems, etc. So, therapy and lab play are part of the relationship-based therapy, and it's intensive interaction between the parent or caretaker and child, where the child is the leader. There's a lot of mirroring and maintaining personal space. The third is the applied behavior analysis, or the ABA, which is a very well-known behavioral program where a task is broken down into small steps and the child is given prompts and rewards to learn that particular task. Pre-language skills are very important, like eye contact, attention, listening, taking turns, also visual strategies. Now, children with autism are visual learners. They learn through pictures, and hence the whole day is structured with picture timetables. With each task can be structured with picture timetables. I also advocate video modeling, where the child is shown a video of him doing something with background commentary going on. Also booklets, where booklets are created to help the child understand his own experience, and this is done through pictures. Verbal behavior is part of ABA, but it is specific for children with good language abilities. It is well known that children with autism may have a lot of words, but they may not use them to communicate. So verbal behavior is teaching them to use words, the pragmatic use of words. Language therapy, of course, would include teaching vocabulary. However, the teaching methods are specific, which means children with autism may not generalize. So if you're teaching them the word car, then a real car has to be shown, the picture of the car, a toy car, different models of cars. So generalization is very important, not only in terms of the stimuli, but also the person who's teaching, the place where you're teaching. Cognitive skills or thinking skills, and especially theory of mind, is taught to the high functioning older kids, where they have to understand the why, reason, verbal reasoning skills. Symbolic play is basically dollhouse play, and it represents the child's daily routine, and it's a pre-language skill, and it helps the child to learn language in a very playful manner. Integrated play strategies is a play therapy technique where the child is taught how to initiate play with other children. Many times they don't know because of the lack of communication skills. They may actually push a child or grab their toys in a way to try and interact with them. So explicitly teaching them how to initiate and maintain interaction is very important. Then there is, of course, the picture exchange communication, or PECS, and this is used for children who have difficulty with word retrieval. retrieval. There's a false belief that if a child uses pictures to communicate, he may not learn verbal skills or talking skills, but this is false, and research has shown that children who use specs communicate more, and in the long run their language skills improve. So the aim of the course is to improve the parents' communication skills and set up a home program so that the child is able to learn at home. We recommend at least 3 hours of work because that is the amount of time a child would need to learn these skills. They should not be forced. They should be done in a playway method or in a structured method. We recommend 3 months, and then of course renewal of package can be discussed if necessary. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.